More than 1,200 lives were saved last year thanks to transplant organ donations from Indiana, and that's a 22% increase from 2023. Earlier this year, Good Samaritan Hospital helped coordinate one of its first major organ donations in over a year. It came as a life-saving gift made by Lisa Wells of Sumner, Illinois. Her daughter, Samantha Wells, is proud to tell her story.
So Mom was 69 years old. She had just celebrated her 69th birthday in November. She was, I would say, my biggest supporter, my biggest fan, and I was her biggest fan. She was as selfless as the day is long. She was such a fan of like dirt car racing, football, college basketball. We experienced a lot of things like that together.
Samantha proudly recalls when her mother made the decision to become an organ donor, inspired by a tragedy that turned into an inspiration. 27-year-old sprint car driver Brian Clausen died after an accident on the track in 2016. But his tragedy in turn saved the lives of 5 people through his organ donation, along with healing many others through tissue donation. He started a movement inspiring more than 7,000 donors to sign up through the Indiana Donor Network's Driven to Save Lives program, including Lisa Wells.
Then shortly after that, when she renewed her driver's license in November, she said, if Brian can do it, I can do it. And I said, yeah, Mom, I think that's terrific. His family had kind of started this campaign, Driven to Save Lives, and they were recruiting people to, become organ donors. There's just not enough organ donors, and so she was excited to be able to do that.
Lisa, a former smoker, had 20 years between her and her last cigarette. However, diagnosed with COPD, she continued to battle with her health when it came to her lungs. Earlier this year, a flare-up unfortunately left Lisa in dire condition at Good Samaritan Hospital in Vincennes, and decisions had to be made.
My dad and I, after talking with the doctors, had collectively decided we were going to remove life support based on her wishes. And they came in and said, hey, your mom was an organ donor. And I said, oh, okay, I forgot about that. And actually my dad didn't even know. It was just an overwhelming feeling, but I thought what a sense of pride she would have. She would be so excited to know that she was going to get to do this.
And with the decision to donate, Good Samaritan officials started putting plans into action, including a way to pay the utmost respect to Lisa and her family with an honor walk.
A lot of hard work has went into this, helping this patient and this family is a very emotional thing for people who take care of the patients. So I think it's a very rewarding that they can see this help someone else.
Samantha says the hospital staff and Indiana donor officials rallied around her and the family, helping to support them during this difficult time of saying goodbye to her mother while looking to do the most good at the same time.
Terrific. The hospital was, the ICU floor, all the doctors and nurses, and then also the staff from Indiana Donor Network. We had different advocates each day, different coordinators each night. And they didn't push anything on us, but they answered all my questions. One of the coordinators even talked with me for almost an hour that night before when her honor walk was the next day.
And when it came time to escort her mother down the corridors of Good Samaritan, Samantha says it was exactly what she had hoped for.
I had watched multiple honor walks before online and probably cried while I watched them, even though I didn't know the people. But to be part of one was a huge thing, and then for it to be my mom was even a bigger deal, bigger than I could have ever imagined. And the support that we had from family, friends, even our local fire department, lining the halls, we were just absolutely overwhelmed, but in a good way.
Samantha and her father approved of the hospital posting her mother's honor walk to their social media accounts, helping to raise awareness of organ donation and the selfless gift her mother made. And it's having a positive effect in our community.
I will say that through this process, I have had at least one person reach out to me and say that because of what she witnessed with my mom, she's going to sign up to be an organ donor. And I had another friend who she wants to volunteer to make the donor blankets because the Indiana Donor Network gives a donor blanket to each donor family, and so she wants to help make those blankets. And I think that's fantastic that people loved my mom that much and love me that much that they want to be a part of it.
Lisa's honor walk is also prompting new discussions that many families haven't thought of having with their loved ones.
It's an important conversation to have, because maybe your loved one wants to do that, and maybe they have not checked the box or signed the paper for their license to become an organ donor. And so maybe you don't know what their final wishes are. And I know death and dying is not a fun thing to talk about, but I think it's important for a family to discuss all of that, just to know where each other stands. And as far as making the decision to become an organ donor, I think look at it like I did, like my mom did. You know, you don't need your organs where you're going. So if you can save a life, I don't know what more selfless gift you can give somebody than to save their life.
It truly is a selfless gift.